The Broken Brain is proud this month to highlight the charity Stand in Pride, which was founded by Daniel Blevins and is an organization that helps members of the LGBTQ plus community to find stand-ins or found family and friends, particularly when the coming out process has caused people to withdraw from their lives. And they might find that they need a stand-in family and friends to attend weddings, funerals, receptions, graduations, things of that nature, and on a deeper level to create that social support system that they, like all of us, need and crave. You can find the Stand in Pride app, which is a way to join and to volunteer and follow through to be an ally or to find people who are there for you. Go to your app store for your phone and look up Stand in Pride. You can follow Daniel Blevins on Instagram or TikTok at _zombie_Dan and learn more about this this local charity that he started. It's a local charity that also has, international reach due to the technology and app. You can learn more about and support their program by going to standinpride.org, download the app. You can donate. You can also buy merch that they have available as well. If you choose to support The Broken Brain and joining our Patreon at patreon.com/brokenbrain, as always, whatever charity we are highlighting in the month that you join, 50% of your donation will always go to that charity for the duration of your membership. Enjoy the show.
The Broken Brain.
Recording in progress.
Hello, everybody. Welcome back to The Broken Brain. It's me, Dwight, your host today, as we look into the intersection between psychology, culture, health, well-being, and just a lot of different stuff. Health and well-being is a good title for today, just as much. We live in a time, don't we always kind of live in a time where there's lots of stress and there's lots of opportunities for us to be overwhelmed by that stress. And so we're going to be focused on that today and some ways that we can work with that. My guest today is Garrett Wood. He is a health and wellness expert and a clinical hypnotherapist, the founder of Gnosis Therapy, and helps people out with his expertise, which has to do with things such as imposter syndrome, burnout, chronic stress, and particularly the kinds of things that come from the stuff that we do. And interestingly enough, we find as success in those areas of living life goes up, a lot of times so do these things. Of course, there's the flip effect, too, of like when we're working hard and not finding success, they're there as well. But I'll let him talk to us about where a lot of that comes from. So, Garrett, thanks for being here today.
Hey, thanks for having me. I'm excited to be here, Dwight.
Well, tell everybody a little bit about who you are and how did you get here?
Yeah. So great question. I've started my own practice in 2018, where I opened doors in downtown Long Beach. And I was working with a lot of people that had chronic pain, and most of that was stemming from stress. So they have those little aches and pains in their shoulder, their back, their neck. They go to the doctor, they go to the PT, they get all the work done, all the imaging, and they'd be like, sorry, there's nothing here for us to help you with. So maybe have less stress. And so
there you go.
The people would be like, okay, great. Yeah, if I could do that, that would be great. What does that mean? Thank you very much. Where do I go? How do I help?
It's a big pet peeve that I have when we still treat psychological health as if it is a whole separate thing than physical health, even though our brain, as far as my medical understanding goes, it is contained inside our body. Right. And instead of saying like, hey, let's refer you to a different department of medicine or a different area of medicine, oftentimes people are told like, well, this is all psychological. So there's the door and, don't come back.
Yeah.
So, yeah, it leaves people feeling very hopeless.
It does. And I've been there too. I've been, on the table much more than I've ever been a prior provider or practitioner. There was one time where I had pretty intense hip pain in my upper groin region. And it got so bad after probably 6 months of this, where general GP was like, I don't know, it's fine, it'll go away. Just keep stretching, do your stuff. PT was like, it'll be fine, it'll subside. So one night I'm in the ER because it was just too much. It was a Friday night after work. I show up, the treating physician is doing a palpatory assessment, and he does some imaging. He's like, look, there's nothing wrong here. So I don't know what you're doing here on a Friday night. There was an insinuation there that how I got my kicks was going into the ER on a Friday night and having someone palpate my inner groin. That was his insinuation. And I'm like, sir,
He's look, sicko, we're not here to get your, jollies by getting a medical examination. Wow. That's not very affirming.
It's not. And I get it. He's probably on no sleep and has been treating gunshot wounds. So like my chronic hip pain is like probably not the right person. And the problem is like we don't have a lot of really well understood mechanisms to make that easier and effortless for people. We are stuck going into like this kind of painted, we're painted ourselves into the corner of the room when it comes to health and well-being. And pain specifically, I think, is better thought of as an emotion, especially when it's chronic pain. And unfortunately, we don't think of it that way. We think of anger, fear, maybe even hunger as something that's like hangry is kind of an emotion. But pain doesn't always show up as one of those things. And it's such a strange phenomena. There's no pain receptor in your body. So there are hunger receptors, and there are, an entire process about satiation and hunger, but we don't think about that with pain. So it's really challenging, I think, for a attending physician to say to me, like, hey, there's nothing physically wrong here, but that doesn't mean your pain's invalid. In fact, we might be working on the wrong end of this. Mm-hmm. Maybe because pain's an output from the brain, we should be talking to a professional about some of that stuff. Have you been under some stress lately? Hey, here you go. Maybe here's a clinical social worker. Hey, maybe here's, an attending physician or a therapist. But that's not the answer in those situations for most people. It's like, all right, well, we don't have a pill to give you and we don't have surgery to perform. So
you can't find underlying organ damage. Oftentimes it's like when that's missing. And, and we're not good historically at considering the brain to be an organ either, right? To say like there's something, if it is a thought process based thing, once again, I kind of go back to we pretend that we believe that's medical, but we don't act like we do, right?
We don't. Yeah, a lot of times we assume it's a personality trait or a moral failing.
It's almost like you should get over it kind of thing, right?
Yeah, man up, tough it out. Could be worse. What's wrong with you? Let's get with the program, right? That's kind of white knuckle it up. Come on.
And I will even go so far as I've worked over, a long time working with lots of different people, and it's not very common, but I have run into people who have what it's termed fastidious disorder, which is actually considered, that's when someone actually knows they're actually purposefully making something up. But the reason that's categorized as a disorder instead of just calling them some kind of jerk is that not that, we can all be jerks and have a health condition. I'm not saying they're not, but not all of them would be. It's not healthy to do that, right? It's not mentally healthy to do that for whatever purpose I'm doing it. So even that is an issue of psychological health. Even if someone was coming into the ER because I really wanted to be here, it's like, well, why do you want to be there? We should probably figure that out instead of just kicking you out.
Absolutely. Yeah. And really, it does seem like a lot of the reason why people are going through these issues is they're not getting the support that they need. That whatever they need to be okay in the environment they're in, there's a gap there between what they really need and what they have access to. Now, trying to get really specific about what to fill that gap is really challenging work. And so I do think that that's why we have such a litany of specialists.
Mm-hmm. Well, what made you go into kind of the specialization or the ways that you treat? First of all, being a clinical hypnotherapist, it might be helpful to let people know a little bit about what that is for people who may not have the background of even knowing really what hypnosis is, other than you can act like a chicken, or if movies are to be believed, you can go commit crimes like a sleeper Manchurian candidate. We know those are true, unquestionably. No, I thought I'd introduce those first. No, anyway, tell people a little bit about how clinical hypnosis works.
Yeah, I do think that's what most people's experience with the idea of hypnosis is what they've seen on a stage show, right? Or in a movie. And that's kind of their firsthand experience that they think about. But really, everyone's had their own experience of hypnosis. If they've ever laughed or cried while they're watching those movies, that's actually a state of hypnosis, or it's indicative that they're in a state of hypnosis. If they've fallen asleep and woken up ever, they've also traveled through a state of hypnosis. And then if they've ever been driving and they get home and they're like, oh, I'm so glad I arrived here safely because I was not paying attention for the last 20 minutes. I don't know where my mind was, but it was not thinking about the driving at all. That's also a pretty common state of hypnosis that most people experience. So what we think of as hypnosis by popular media and what our personal experience is, there's a big gap there too. So it's not this strange, unknowable, mystical, magical. I mean, going to sleep is pretty strange and mystical and magical when you're there dreaming, but
and awesome sometimes. But no, that's one of the big misconceptions, right? And sometimes the people I know will just talk about kind of a trance state. And a lot of times, and you're seeing this with different therapies that induce some kind of a state, even psychedelic therapies and things that are being used now. Now, I'm not saying that's the same. You'd be the expert on that, but there is a disassociation, a purposeful disassociation that people are trying to initiate. I don't know if disassociation is a good word when we're talking about hypnosis. I know it's a deeper trance or relaxation state, right?
So the idea of disassociation, I think, is an interesting one because we can't completely dissociate. I think the word itself, I mean, words are impractical tools sometimes, but they're all we have. So we do the best we can with what we have. It's a reassociation of our attention onto something else. So if you're in a book and you're reading a narrative, you can read as the fly on the wall. You can read as the all-knowing, omniscient God. You can also read as the first-person character or the other first-person character. You can hear the thoughts between both of those people. And anytime we're in that environment reading a book, we can associate from the author's perspective whatever they're doing. We can do a version of that in our own life. I can think about how you're thinking about what I'm thinking about. That theory of mind is a version of that. But in that state, I'm probably not 100% present. I'm thinking about the thinking about. And so that is at a disassociative state.
I see.
Versus like playing basketball, you're not thinking about I'm dribbling the ball. I'm reaching for the basket. You're not narrating that as you're doing it. You're just responding and acting. But I would argue that's also a disassociative state because you're so hyper-focused. So
kind of demystification here of saying this is not some kind of weird, crazy magic kind of that's happening. It's actually utilizing a natural, stronger version of just a reframe. It sounds like if your perspective is changed in a way that feels different, but not so much different that it's like some kind of mystical thing. It's a thing we can do with our brain to what do we do with that as far as how does it help?
Great question. That's my favorite part. So there's a couple ways. If we're always on in this stressed out world, there's where never feels like it's safe enough to relax for whatever reason, or we don't enjoy relaxing. Some people don't enjoy relaxing. Hypnotherapy is a really phenomenal tool. Hypnosis is a phenomenal tool to be able to get out of that state and into something that's a little bit different, a little bit more restorative for our nervous system. If you want high performance, we need to have higher performing recovery. So it's helpful that way but then once you're in that state, there's some extra fun things we can do in there too, which is where the therapy part comes in. It's where we can use what they call coherence therapy or memory reconsolidation, which is my favorite part of how the brain and memory works, because our brains are there to predict the future. It's all they're trying to do at all times. And they base it upon all the simulations they've experienced in the past. And so we're trying to get those two to when they don't match up. That's when we go into the cognitive dissonance and we go, oh, okay, am I wrong about what I thought? Or do I need to look for more confirming? And that's where we have a chance to create some changes for people. And so hypnotherapy is a really awesome tool to be able to get in there when that happens and reinforce some of the good and probably heal from, mitigate the intensity, reassociate to some of the past painful stuff that we've gone through.
So then as it has to do with altering a little bit of the expectations or maybe the story we're telling ourselves as we anticipate things or move forward?
Even the filters that allow us to think about what those narrative beats of the story we're telling ourselves. So if when we think of something that's happened to us, we're not remembering when it happened the first time. We're actually remembering the last time we remembered it. And so over time, our memories shift into these really powerful, distilled experiences. which is kind of what nostalgia is. You're like, ooh, the cheeseburgers from McDonald's taste really good when I think about the Happy Meal when I was 7 years old. And then you go and get the Happy Meal and you're like, did they change the flavor? This doesn't taste like my memory makes it feel. What the heck happened to this one? Is it the ingredients have been bad for the last 30 years or however old I am? Or is it that my memories intensified this thing to the point where it's actually not replicable in the real world because it's flavored by my memories and the intensity of that? That amping up that memory every time and distilling it into this really intense experience. We do the same thing, not just with like nice things like nostalgia. We also do it with scary and intense things as well.
I remember a trip that I went on as a kid. We went to Disneyland, and I had been there years before that as a younger kid. That's how I track time. Anyway, and I had this memory of Pirates of the Caribbean that it started with this huge, and in my memory it was like going, down this huge slide into the water, and I was a little nervous about stuff like that. Didn't really love that. And in my head I had this picture of just a hole in a swirling vortex of water that we would have to go through, and I was like real nervous about it. And we got on, and if anybody's been on the Pirates of the Caribbean, they know that first drop is probably like 5 feet, maybe. You go down this little tiny slide is the very first thing. It's like whoop, and then we're there, and it's mostly, I think, just to demarcate that now we're in the magical pirate land. And I remember that as a kid going like, wow, that's different than it was. And that a concept of being like, that was so scary. And it's like, it's not really, that's from the current perspective. Now that's external, measurable, noticeable, so not as traumatic maybe to go, oh, I can readjust that expectation very easily.
Well, and you went through and had a chance to replicate it one for one, right? And so you were able to see, oh, wait, I have these new skills, these new resources. Oh, it's not as scary as I thought it was, right? And you actually went back and tried it again. Sometimes you don't get a chance to do that if you don't go back and try it again. You avoid it. You're like, oh no, pirates, that's so scary, not for me. And then you could be an 80-year-old person and never having gone on the ride again because it's the scariest thing.
And of course, it complicates it if it really is terribly scary. I mean, there's a lot of, and I'm definitely not trying to minimize any the experiences people have that are actually traumatic, as people know. Yeah.
There's a lot of them. If you live for long enough, you're going to be able to go through some trauma. That's the fun of life. The longer you live, the higher the odds of that are going to happen, right? It's not if, it's just when with some of that. And so being able to have skills and resources and abilities to be able to manage those when they show up is a really important part of having like a well-lived life. And so some of that, when you're recalling the memory, if you're in that deep, focused, relaxed state, your nervous system, that state that you're in, like you were talking about, an older child, you have way more resources. And so you went through it again and you're like, oh, okay, not that bad. And the next time you went, you're like, oh, even less scary. Oh, I could probably go on bigger. Maybe now I can go on I forget the Splash Mountain, where it's like maybe a 2-story or 3-story drop instead of a 5-foot drop. And you could experience the thrill of it instead of the terror. But in hypnotherapy, you can do that same thing where we can bring all of our current experience that we have now, our calm, relaxed state, our wise mind, whatever we want to call that, back to a moment where we didn't have that memory that lives there. And we can actually change kind of the soundtrack or the lighting. So instead of being this tragic horror movie, where we have the da-dun, da-dun, da-da-da-da-da-da-da going on in the background, we might be able to make it a little bit easier so that way when it does show up, it doesn't overwhelm our nervous system. We can kind of stay a little bit more present. And we can make it easier just to be you. Yeah.
It strikes me that this is the other side of one of the things that people talk, and many people out there are probably aware of the risk, let's just say the risk in general of memory, but particularly we hear people talk about some of the misuse, let's say, of some of these things, like hypnotic recovery of memories and then assuming that they are absolutely concretely what happened. There's been tremendous harm and errors done by people over time. And now what you're talking about to me is the healthier side of the sort of malleable function that is memory, of saying we can, bring tools into this memory because we are actually living it Just the same reason why we shouldn't put a lot of stock in like, in this state I came up with this memory where I was fill in the blank by aliens or Bigfoot or whatever. Not, to say that that's literally true. Shouldn't take that as our resources. You got to have photos of Bigfoot, fuzzy ones, and not just this reclaimed memories. So therefore, it sounds like the positive side of that, the healthy side of that, is to work through memories with, like you said, additional tools. Am I saying that? Am I saying all this in a good way?
Yeah, I think you're doing a good job of explaining it. Yeah. Bigfoot aside, I think, if you did have an experience with Bigfoot and it was scary and overwhelming and you forgot to get your camera out, or your hands were shaking. That's why it was so blurry.
Yeah, right.
Hopefully next time.
You can work with it without, we're not verifying it. We're just working with the trauma. Right. And I'm not taking a position on Bigfoot out there, everybody. So don't at me on social media about, you'll have to send me your pictures.
About Bigfoot. Yeah. But that idea of being able to be more open and not avoiding those activities and being able to stay more present in the future when those things do happen, so you can show up as a better version of yourself, is really a more well-resourced version of yourself. Because a lot of time, too, we're going to have to go through intense experiences. And the faster we can recover from those, the easier it is to be yourself. If it takes you 10 days to recover from something, or 10 hours, or 10 minutes, that duration of how long that lasts afterwards makes a big difference in how prepared you are to handle the next thing and the next thing and the next thing. Mm. And so a lot of times people get into a state where they got a new job promotion, or they lost the job that they wanted, or something new comes in their life. Maybe it's a good thing or a bad thing, but the rate of intensity and disruption to their day-to-day existence is much faster and more intense than it used to be. And so their skills and their resources don't seem to be adding up to be enough as they move forward now. That is some of the benefit that comes with doing some of that work.
It's very interesting to me, taking your example of the job thing. It's a real observable way to say, here's how this dynamic works. That we can have maybe different flavors, but maybe even equal stress based off of I got the promotion, or I got passed over for the promotion, or even laid off. That there's maybe different types of feelings, but they can have just the same intensity. In fact, sometimes the thing that everybody assumes we're just celebrating, in some cases, might even have more stress for depending on the individual, right?
Absolutely. I remember the first time I stopped believing in wishes. I'd throw a coin in a fountain when I was a little kid every time, and I'd wish for the same thing. Every birthday, I'd wish for the same thing. Every time I talked to Santa in a letter, I'd wish for the same thing, and it was for a dog. And then as an adult, I got one. And I was like horrified, like, oh crap, you got to feed this thing. You got to potty train this thing. You got to get shots. What if it runs away? Like all the 50 things that, you needed to have pretty solid answers for this living, breathing, furry thing. And I finally got the thing I wanted. And yet I was more stressed by getting the thing I wanted than I'd ever been about not getting the thing I wanted. And it's, we think about the promotion or the new car or some of these things like, oh, it's going to make me feel good, or I'll be happy, or I'll finally have some. And that's not always true. There's much more intense feelings that come along with getting it as there are without getting it. And that's not to say that like losing a job and not knowing if you're going to be able to keep a roof over your head and getting a promotion where you can now decide where you're going to go on vacation are the same type of stress. But that doesn't mean that stress isn't stress.
I know, because I know I have that gut reaction of like, well, I know which one I'd rather have. But what we're talking about, though, I think going back to this idea of do we respect psychological stress? And certainly there's practical things, and I may have more space to work with something if I'm not worrying about my next meal, obviously. I mean, I don't think we're diminishing that, but saying that there can be and is, there's opportunity for distress, damaging stress in almost all of our life situations. And I think it does depend maybe on those filters, maybe experiences, or even if our people who have high anxiety do tend to be higher also in intelligence and being able to make predictive, and we're used to being maybe on the right track when we try to figure out what's going on. And it's like this bad thing could happen, that bad thing can happen. And maybe even more so when they're actually real. It's like if I don't make quota, I'm going to blow this up. I'm going to lose this. I'm going to be under more scrutiny. I'm going to, I now have to do this job. That's not fake. Right. I mean, that's very real.
It's very real. And it's a very real stress. And it's something you have to account for. And in sports performance, they talk about the yips or choking, where you're so focused on the outcome that it stops you from being able to do what you know how to do very, very well. And so my favorite version of that is like a fear of heights. Everyone's like, oh, I don't have a fear of heights, or I have a fear of heights. But even if we were to like take a plank and it's, a foot wide and 12 feet long, if we put it on the ground, most people that walk every day would be able to walk on that plank and not think twice about it. They could probably even close their eyes and touch their nose, or they could chew gum, or they could be doing math times tables and they wouldn't be thinking about it. They could be in a disassociated state thinking about, what work problems and emails they have going on. But if we start raising that plank like 6 inches or 12 inches or 3 feet off the ground, their ability to multitask and feel confident walking that plank starts going down. If we raise it 10 feet off the ground or 2 stories or 3 stories off the ground, there's some people that are not going to walk across that. And it doesn't matter how much we incentivize them, they're just not going to. If we raise it 10 stories off the ground or 100 stories, there is going to be a lot more people that are not going to want to walk across that. But nothing's changed about their ability or their skill to walk across that plank. The only thing that's changed is their perception of the risk.
Yeah. And also the feedback you get from other people is going to be, don't go for that. Because, and not bad advice when it's 10 stories off the ground, I guess. But you're not going to get people around going like, oh, come on, you can do it. They're going to be like, no, I get it. You don't want to fall 10 stories. I'm not going to be the one who told you to do it either. So the feedback maybe that we even get socially changes too.
Absolutely. It starts getting riskier and other people getting scared for you or on your behalf, right? But if you're having a quota and the stakes start feeling higher and higher and higher, okay, now I have the dog and the partner and the house and the car that gets in the house and then the title that comes with it. We get really adapted to all of those things really quickly as just being the new baseline minimum for what it means to be okay as a person. But it comes with a lot more responsibility to maintain. If that's all relying on your quota, then you're picking up that phone or making that email. Ooh, it's like raising that plank from the ground all the way up to 100 stories. And now it makes it really challenging to do the job every day. And if you have to do it every day, all day, that's going to have some detrimental consequences to your health and well-being.
And so this can be true also with, we tend to tie this as we're using job analogies. I like you're throwing in some other analogies there. A dog, relationship, safe living environment, whatever. These aren't all, the last one maybe, but they're not all tied with money. If I'm in a great relationship and I'm not used to that, it's like that's going to be intimidating or getting the pet or whatever. I could still be having whatever struggles I'm having in this area versus that area. There's always opportunity for success to be stressful because now I also have stuff to lose is a big part of it. It sounds like you're saying.
Absolutely. The stakes go up. Mm-hmm. And the bigger the consequences of the risk are, the more we become critical of our skills and our abilities, even if the skills and abilities haven't changed, even if they've improved even. And so sometimes the more success we have, the bigger that gap comes in our confidence to feel like we can make those steps, whatever they may be.
And that's where then you're getting into that terminology that people use a lot nowadays, the imposter syndrome. And I'm curious, maybe could you tell people a little bit about what would you call the difference between just saying, I don't know if I can do stuff as well, or I have low confidence, and then what we would say is maybe a deeper version of that, the imposter syndrome?
Yeah, imposter syndrome, I think, is easier to define by intensity. So the more success you have, the more anxiety you have about maintaining that intensity is indicative of someone who has imposter syndrome.
And yeah, to maybe talk about that dynamic a little bit of how does that amplify or what comes from that?
Yeah, so I think a lot of people who have imposter syndrome are actually really successful individuals. They're so successful, they know how horribly wrong things could have gone and didn't, and how little control they actually have at getting things to go right. There's that Dunning-Kruger curve where like the little we know we can be really dangerous with because we can assume this like superior level of confidence. Mm-hmm. And then we move through that because we make some mistakes and learn some more and our self-confidence just plummets. And then eventually we start getting to become a little bit more effective, and we develop some skill and then eventually some mastery. Socrates has that famous saying, the more you know, the more you don't know that you know. Mm-hmm. And I think that the people with the biggest amount of imposter syndrome are acutely aware of how much there is to know and how little of it they actually feel like they could know because they've been doing it for so long. So I do think it's actually indicative of someone who's smart, intelligent, driven, passionate, curious, and is showing up and putting in the work every day.
Mm-hmm. Yeah, it's interesting balance, because I think there's something healthy about recognizing what I can versus can't control. If I need a job, I can control if I apply, and if I don't apply, I absolutely won't get one. However, the more I apply, and I think I'm seeing this a lot with people nowadays, there's with the job market the way it seems to be now, you apply for a lot more before you get any response. And the more you do, the more you realize, A, I don't actually control very much of the outcome, and B, I start to lose faith in the empowering feeling that I get when I do apply, because it doesn't feel like it's doing any good anyway. Yeah.
And then how long can you sit with that uncomfortability? How skilled are you at that for how long, and still being able to continue to do those actions with no return? There's a lot of people that get scared about starting their own business and enjoy doing W-2 because, you do work, you get paid. You do work, you get paid. And that feedback loop feels really comfortable for people, even if they're doing a lot of work and not getting paid what they could be worth if they were doing it somewhere else for themselves, because that feels scary. You can do a lot of work and maybe not get paid. And so that uncomfortability, that lack of control, it's that skill of being able to be like, okay, the skill is just taking one foot and putting in front of the other and continuing on. Even though there's a big risk, can I be okay enough to do that? And that's not easy to do. It is a skill that we have to practice and develop over time.
So what kind of things can people do to start this and say, if people recognize these things in themselves that they're going through? And I think almost everybody out there can probably identify some of these kinds of things they're going through. I like how you clarify with the idea of intensity. What is this intensity and what are we seeing? So yeah, what would you give people as some ideas?
Yeah, I would say that the more enjoyable the things in their life are, and I don't mean in the moment enjoyable, right? Like long lasting, I did it today and I'm happy I did it 3 days from now, right? Like I did it 3 days ago. I'm happy I did it 3 days ago. I'm going to do it again, and then I'll be happy I did it 3 days from now. Whatever that thing is, doing more of it, increasing your well-being in every category or domain that you possibly can, makes it easier to be able to show up and work harder in the one domain that's not really going well, that you want to change. We need to be able to have more resources available to us to be able to focus them in on the things that we're trying to actually focus in on. Yeah, everyone wants to go into the gym and lift all the weights on the first day. And it's like, that's not actually going to be helpful. It's going to probably hurt you and harm you. If there's something you're trying to change and work on and it's really challenging you and distressing for you, we need to be able to get out of that state, get back to a calm nervous system, a relaxed state. And whatever we need to do it is worth it, because it'll pay dividends in the long run.
I find that with physical exercise, I think that people's expectations get mixed, because particularly nowadays we have so much, and so much of it is good. But if you want to say lift weights, for example, there's a lot of information out there, some good, some bad, that tells you how to do it. But mostly it's all oriented around practical goals, which nothing wrong with that. With exercise, of course, you're going to have practical goals. I'm going to get stronger, or I want to get buff, or whatever it is that the goal is, and maximizing that. But I think the expectation, when we're looking at de-stressing and psychological benefits, I'm a believer that, the practical gains and the schedule of those, and if we're getting them or not getting them, that's great, but that's not, we don't need fast gains, any, type of specific schedule or of those type of results. We can still benefit psychologically just from engaging and starting something. But it's fascinating to me how, if we don't know that or don't think of it that way, we don't get the psychological benefit of doing it, because it can become another burnout opportunity, right?
Absolutely. If you're waiting for an external outcome to show up from all your effort, we are in trouble, because now we're just doing another task with no reward.
Yeah.
And so that's distressing to us, to our nervous system, to our perception of ourselves, others, the world. And if we're waiting to feel good, even though this thing takes a long time to do, 6 months, 7 months, 6 years, that's a long time to be in that distressed state. We got to figure out how to get out of that state to be able to consistently show up, to be able to stick around for 6 years or 6 months or whatever it may be.
Yeah. What kind of, when we see those obstacles, whether it's perspective or maybe the thought, well, I don't have enough time to do that, to do anything, not just weightlifting, but anything. I don't have time to find that healthy improvement or whatever, or increasing wellness, or it's overwhelming. What do you see as ways that are helpful for people to overcome those obstacles, those barriers?
I think you mentioned there's a lot of good advice and a lot of not necessarily great advice or misinformation out there about health and wellness for sure. Strength training, fitness, absolutely. But a lot of it also is geared towards maximization of time and efficiency instead of longevity or benefit to your mental emotional state. There's a lot of studies out there that show that if you are challenged with executive functioning for some reason, being active for as little as 3 minutes is actually going to help your brain work better. That if you're like, but the advice is, oh no, I have to do 20 minutes minimum 3 to 5 times a week to get a cardiovascular benefit for my heart health. Well, if I'm having a hard time with executive function and I'm on the couch and someone's telling me, no, I have to do it 3 to 5 times a week for 6 months to see any results, I'm not going to do it at all. But what's interesting is if someone goes, hey, the real truth is if you do as little as 3 minutes and you get your heart rate up just 20%, you're going to get an immediate benefit to your executive function, which makes it easier to then like go wash the dishes or brush your teeth. It's very different. We like take this like Olympic level effort and idea and prescription and think that's the thing. And if I'm not doing that, I'm not doing anything. Mm-hmm. And that's actually the inverse of that is like, it's just what we need to do to even begin to do any of those things in the first place. Like 2 minutes is going to make it feel easier to do 4 minutes. 4 minutes is make it easier to feel 5 minutes because it actually changes your brain. It actually gives your brain the thing it needs. It's like taking a deep breath sometimes.
How does treatment enhance this? I come into your office today and I say, hey, I'm all burned out and, I'm, going to just chuck I'm going to go quit my job tomorrow because I can't take it or something. I don't have to be in that much crisis if this scenario is not helpful. But anyway, I come into your office and I do that. What are some ways that, treatment can help me to recover and start that healing?
Yeah. So there's so many, if you've met one person in burnout, the saying is like you've met one person in burnout. What's driving their specific version of it is unique to them. And so instead of trying to guess what will be helpful, because there's so many tools and levers that we could press, and all of them are good, but they're not going to be the one thing for you. Like, I don't believe in a magic bullet. I definitely believe in magic bullets. There's something out there for everybody. If you're like scrolling on social media, like, that's the thing, that must be it, I'm going to try it. Oh, it didn't work. That doesn't mean that thing doesn't work. It means it's not what you needed in that moment at that time in your life with where you're at. Mm-hmm. So we would start off very simply. Let's assess. Let's not guess. Let's figure out what's actually going on, what's going well, what's not going well. And then we would try to accommodate what your nervous system, your unique nervous system actually needs as best as we possibly can with the resources you have in a very simple, practical way. And then from that place, we're going to go in and be like, okay, now what can we change? Mm-hmm. What's the next low-lying fruit that's really easy to get it easier to be you? And then let's build that system from there. So instead of pushing that rock up the hill, like that Siphian, whatever the Greek god is.
Sisyphus.
Sisyphus. Yeah. There we go. Good job. Yeah. It would be rolling that rock down the hill, like that snowball gathering steam. So as we go, we start with the easy stuff and it just gets easier as you go. And so it makes it easier to do harder things with less effort than it did to take the easy thing eventually. Mm-hmm. That's the goal.
Mm-hmm. Wow.
Yep.
Well, it's important for us to be aware of, and I also think that sometimes there can be an assumption or maybe even a guilt or shame feeling of like, I got a good thing and now I'm stressed. I mean, sometimes we might not even connect that it's from that because we feel guilty about feeling bad about something that was good, right?
Yeah. Feeling bad about feeling good about something that feels bad, or bad about feeling good about something that was bad. Yeah.
And there's the shoulds, right? Well, I should just be happy. Like you had said, I should. it's a little, and honestly, if I go to someone and say, boy, I'm really having a hard time, and they're like, yeah, you're doing a lot better than me at some of those things. So, for those that listen to the audio only, I'm flipping off the screen. I'm not flipping off Garrett. I'm just in that scenario saying we get that feedback from someone that's like, why don't you get over it? As you put it. And so overcoming that shame, I think, is important to have this dialogue we're having so people can say, it's okay that I need help.
Yeah. There's a lot of thought terminating cliches out there where it's like meant to shut down your introspection. It's meant to shut down that cognitive dissonance, to get you just to be able to like put your head back down and go back in. And sometimes that can be helpful in the moment where you're trying to walk across that plank and it is 30 stories down. Sure, we need to be able to have some tools to quiet it down. But once we're on the other side and we have a series of those things to do, that's where those thought terminating cliches are not really helpful. We got to get in and figure out, okay, why am I feeling shame and blame and guilt about this thing, whether it's good or bad? What's slowing me down? Why is it there? Okay, what can we do about it now? For sure.
Yeah. Well, thank you for sharing this. Very important. As I said, I want to give people the chance to follow you and know where they can learn the things that you're doing out there and your work. Before we share that, though, I always like to ask everybody if they have something that they could share with people out there that is a kind of a good pro-social things to be involved with, whether it's a charity, a nonprofit, or something that you see as a need out there that people can fill. What would you suggest to the listeners?
Yeah, I'm a big believer that health is actually mental health. And the better our mental health is, the better everything else will be. Our relationships, our work, our fitness, whatever it may be. And I think it's the one that we forget about or are too ashamed to talk about or struggles with it. So one of my favorite things is the National Alliance on Mental Illness. They have chapters everywhere. They do a really good job supporting individual people in a local community. And support groups through there as well. So every little dollar goes right into the hands of someone who needs it in like a really important way. So I'm a big fan of the work they do.
Yeah. I've became aware of them a long time ago working in mental health. And I feel like they're almost one of those like best kept secrets that we really are trying to let people know about, right? There's a lot of those things out there. And I've known even in my area, they even have advocates who might be people who are retired teachers or have a lot of expertise that will sort of go in and help people even work with the special ed needs for their kids or getting IEPs set up, suicide support groups or, survivors or caretaker support groups even. And just a lot of work that they do. Yeah, it's a great place to get involved. And if you have a desire to give back too, if you have the time to volunteer at a place like that, then that's a great thing to do. So thank you for sharing that. Where do we find you?
Absolutely. Yeah, if someone wants to be very professional, they can follow me on LinkedIn at Gnosis Therapy. They want to be a little more informal, they can follow me on Instagram at Gnosis Therapy. Or if they want to reach out directly, my website's gnosistherapy.com. So,
right. And that is with a G.
Yeah, the G is silent. It's GNOSIS Therapy.
Well, thank you so much for taking the time and for being here today. One quick reminder, everybody out there, that we have the charity highlighted for this month that was mentioned up at the very, very top of the episode with the opening. And so if everybody is aware of that and wants to promote that as well as talking about NAMI as we were, also anybody who decides to join the Patreon and help the Broken Brain podcast to be going around, it's as always 50% of your donation will go to the charity of Focus in the month that you joined for, as long as you are a donor. So that is something to be aware of as well. So Garrett, thank you again.
Thanks for having me. Excited to have been here with you. Thanks.
Thank you for listening to the Court and Parts Podcast Network. To listen to more Court and Parts shows, visit courtandarts.com.